Thank you so much for being here today. I just told everybody kind of who you are. You're a top functional medical doctor. And I love everything that you've been doing. I've been stalking you for a while, but
Thank you.
but especially recently, everything that's going on. I love the way that you post in such a digestible way. I think there's so much like misinformation out there, and God, there's like a lot of flies all of a sudden. And I just love the way that you put things in context. Like you take really complicated situations and you make them a little bit more understandable for us people.
That's what, thank you for saying that. That actually, when people ask me what my skill set is, that's one of the first things I say is that I hope, or my goal is that I break down really complex scientific topics so that everyone can be like, okay, now I understand what's going on in my body. Because I really feel like it's a fallacy. It's not true that the general person cannot understand their body. That is not true. If you explain it well enough, you don't get it well enough, right?
Yeah, that's so true. And I think right now, and I love your post that you did today, and it's so relevant because I think that's where I would love to start is, I don't know if you know, but a lot of my followers know that I was diagnosed with rheumatoid arthritis 11 years ago.
Oh, wow. 11 years ago. Wow.
Yeah. So I have rheumatoid arthritis. There's a lot of people that have come to me, are you scared about the coronavirus? Are you considered high risk? And I'm not taking any medication right now that I feel like would make me more of a high risk. But there's a lot of talk about the inflammatory factors and what you were talking about with the innate immune system and how it kind of, it inhibits that, right? Or it's, I don't know, you're going to tell me more about it, but are people like me, even though I'm not on any like TNF blockers or autoimmune suppressants, am I still considered high risk?
Not necessarily. Now, everyone's a little bit different, right? So let's say I don't put you in the same category as maybe a rheumatoid arthritis patient that's, 30 years older and probably eats the standard American diet, right?
Yeah.
You know what I mean? That's a completely different type of patient than you.
Yeah.
So like, even though it's the same diagnoses, it's like a whole 180 of the picture. So those two patients can't even really be comparable. Because there's such a wide variety in what one rheumatoid arthritis patient looks like as compared to another one. And that's just because, and I want people to understand this, the system has done a great job at looking for sickness and disease. And that's because billing is based on ICD-10 codes. So we have to give your constellation of symptoms a label. So just because, that we can't treat it, we can't bill for it without a label, right? So your rheumatoid arthritis picture could be a constellation of symptoms that's vastly different and much more mild than another rheumatoid arthritis constellation of symptoms that's been labeled in another patient population. Does that make sense?
Yeah. I mean, I definitely, even in my own diagnosis in the last 11 years, have fluctuated depending on, flare-ups and diet and stress. And I know you love talking about the emotional connection. There's been periods of my life where I had a lot of stress, where then all of a sudden it revealed itself again, situations like that. And then there's the other side, which I think is really interesting too, which I've heard you talk a little bit about, is some of these rheumatoid arthritis medications are actually being used as treatment, right?
Yes. So that's so true. And it's because, they go intracellular, or they help something like zinc, which helps us fight off infections, go intracellular. There's a number of these things, not just hydroxychloroquine, which is the one you're referring to, which is also known as Plaquenil within the rheumatoid arthritis community. And this is really, honestly, an immunosuppressant. It's more of an old school medication. Have you ever been on that one, if you don't mind me asking?
No, it's so funny though, because prior to all of this happening, my doctor prescribed it to me because I've tried everything. I've done everything. And unfortunately, I haven't had a great result with Western medicine dealing with rheumatoid arthritis. I've been able to use it in the past as like a bridge to get me out of the excruciating pain. And then I've had to do a lot of work on myself. I mean, I'm sure you know, like living with a chronic disease is a full-time job in itself. So it's my other full-time job. But just before this happened, I was given a prescription and I had done the research and I was like, okay, well, if it's for malaria, because it's originally for malaria, which you would take it for 10 days, the side effects aren't as bad. But for someone like me, where it would probably be used for the rest of my life, the side effects are like blindness and all these crazy. And I was like, you know what? I'm just not there yet, you know? Maybe in the future, I'll have to rely on something like this. But needless to say, I have the prescription and now I'm holding sacred to that because I'm like, I just might need this, you know, just in case I have this little golden ticket.
Seriously, there you go. Hang on to that. That's a highly sought after prescription right now.
Yeah.
Yeah, the thing about what I want people to know about that one, though, is it's not alone. It's not useful in the studies. It's useful when given with zinc. And that's not because hydroxychloroquine does anything specific other than help zinc get into your cells where they help fight and temper oxidation and all kinds of other things. And so that's the real issue is, you know, how much underlying inflammation do you have? A lot of times autoimmune conditions can indicate underlying inflammation. And that's why everyone is so freaked out about this. But really, you have to look at yourself as a whole. Do you walk around in pain every day? That's a level of inflammation. You know, do you have any other risk factors? Do you have the high blood sugars? Do you have a high stress job in life every day? You know, all this needs to be taken into account, right?
Yeah.
But back to hydroxychloroquine, that's the whole point of that one. It's not even beneficial, really, unless you're taking it with zinc, so, a micronutrient.
Yeah. And so other than like, I mean, there's been so many, everybody's kind of giving their own supplement guide and nutrition guide and things they're doing. I've even told people what I'm currently doing. What are you doing personally at your house right now? Are you doing anything different? Do you have more things on hand? Like, what are you doing?
So I have to tell you that my boyfriend and I are getting ready to go on a road trip for a couple months and
cool.
virtually. And yeah, I'd probably go back home for a little while. And he asked me today, do you think we should have anything in case for COVID? You know, should we have anything? And I really actually said no. And I'll explain to the audience why. This was my honest answer. You guys can ask Jason if you want. I basically said, you know, I really would just I'd rather just make sure that I can work out every day and that I have healthy food and that I take a few of my key supplements. Because what I've learned throughout my career is I can't give anyone a magic supplement. If that virus gets a hold of you, it's probably got to run its course. It really matters how your health and foundations of health have been prior to the arrival of coronavirus. And so, you know, and this means things like sleep. Do you feel rested in the morning when you get up? Do you, you know, do you have energy? Oh, geez. Sorry.
It's okay. I got one too. It'll probably start barking at some point.
Do you have energy throughout the day? Right? You know, I mean, these are indications there may be something wrong with cellular energy. There may be something wrong with, you know, your sleep patterns. There may be a hidden pathogen that's really interrupting your immunity, right? And so people really need to look at these things. And so for what I'm doing, I have an infrared sauna. And so I really like to get in the sauna and activate my heat shock proteins.
So is this part of the kill, bind, sweat?
So I don't always kill, bind, sweat. I'm lucky enough that my body's like a tank. I'm not really, this lifetime, not really that sick. If I'm going to have Parkinson reactions, I get fatigue or kind of frustration and emotional stuff. But you know, for me, it's probably because I've worked out my whole life, and I really, I get in the sauna. I don't always bind. I don't always kill. Sometimes I just sweat, you know, because that's prevention too. And sweat alone is a kill part of the treatment. If you ask chronically ill patients, sometimes sweating is hard for them. man, sometimes that can activate and stir things up and make them feel like crap.
I did see that on one of your IGTVs. That was really interesting because I'm a big advocate too. I mean, just for my joints, like it makes me feel better. I feel more loose and lubricated when I'm always cold. So like to end my day in the sauna, I'm like, it's heaven for me. It helps me sleep and all of that stuff. But I did see that, I think on one of your IGTV, that it could kind of like bring something to the surface if you have other things going on.
Well, think about it. If like, you know, your sweat pathways open, but a lot of your other detox pathways are blocked, you know, your drainage pathways, like let's say your liver, let's say you have trouble with shortness of breath or something even, then stirring all that stuff up in the circulation and the sweat, it may not leave your body very well. Sweating may not be enough. So it's basically like your drainage pathways aren't open. You're sort of like clogged. And so you're holding on to a bunch of toxicities and exposures on a daily basis.
That's so interesting. I see that a lot. I'm a yoga teacher as well. And I don't teach right now, but when I used to teach, I saw that a lot with hot yoga students where they would get violently ill. And it's like, well, you got to back it up with like also eating well and hydrating and maybe not drinking the night before because you will get sick. Yeah. Let me see. I want to ask you some more things. So what are some basic supplements that you take just on a regular basis?
So honestly, I love this company, Cell4 Biosciences. That's their practitioner company. They have a retail company for the layperson that's microbe formulas. And they are, you know, I'm in sort of the hidden infection niche. So I really feel like 25 to 35% of our illnesses, chronic illnesses, are due to stealth infections that are hidden in the body. And so this company really specializes in things like parasite cleanses and mold and Lyme and co-infections. And they even have binders that you don't have to take away from other food and supplements. And you can take them, and they're for radiation, chemicals, heavy metals. Like, it's amazing. They're one of the best biochemists in the world. So I'm really stuck on their products right now. Like, I'm in the middle of a parasite cleanse, to be honest with you right now. So
I love that.
Yeah, you know, I feel great and I'm sleeping like a rock. And then my boyfriend is actually like getting worms out. So
wow. Yeah. I mean, I think that's such a good point too. Like, if you're not doing well, what a great opportunity right now to zoom in on some of this stuff. And I think everything you're talking about, I think a lot of people are dealing with that and don't even know. Mold and all these issues, parasites.
No, I mean, give like this like label or diagnosis, and they're like, okay, well, I guess I have this. This is my life sentence, and my labs are normal, but I don't feel normal. But I guess this is just the way it is. Yeah. And I just want to tell people, like, no, don't accept that. It's not okay. Like, if you have an autoimmune condition, if you're always fatigued and you don't sleep well and you're like in your 20s and 30s, there's no excuse. If you eat so well and you can't lose weight at all, there is no excuse. There's something wrong. And there's something wrong. And your body is telling you, and you need to find a doctor that listens to you and doesn't tell you that there's nothing wrong and slides labs over across the table and says you're crazy. That's not okay. And your body knows, and you know, and I just need people to trust themselves.
Yeah. Yeah, it's so true. I actually, one of the last times that I did medication and why I stopped was, a lot of people don't realize, but a lot of these medications for rheumatoid arthritis kill your immune system, and you can end up getting chronic infections. Yeah. And so not hate, antibiotics have a place, but I try and not take them. I got so sick that I had no choice. Bladder infection that almost turned into a kidney. I mean, I was done for doing all the holistic things. And I ended up getting like antibiotic overgrowth. I thought I was going to die. Like it was the worst. And I mean, I was gaining weight, even though I was eating the same. I weighed the same for my whole life other than being pregnant. I felt lethargic, and I had to do a whole sweep of just eating clean and, all the cleansing and herbs for like 6 months before I felt better.
You probably had SIBO.
Yeah,
you probably did. That's really common after antibiotics. And just so you guys know, SIBO is small intestinal bacterial overgrowth. It literally feels like somebody's just pumped air into your gut. You're walking around. I mean, literally.
It's like just puffy. Yeah. I was, and just uncomfortable. Like I just felt like 1,000 pounds, you know, just very heavy in my body.
Tired and heavy. It's the worst. Mm-hmm. And just, they're asking, it's microbe formulas, guys, MICROBE formulas, and Cellcore Bioscience is the practitioner company.
Is that on your bio in your link?
It's actually not.
It's not?
It's not. I'm getting ready to start working with them because I found them and I approached them. Nice. Yeah. So I'm getting ready to start working with them, but it's not in my bio yet. It's that new.
Yeah. That's how you know it's authentic too.
Because, I mean,
when you reach out to them, I reach out to companies all the time. Like, I actually love what you're doing. How can we work together?
Yeah, exactly. I really, that's the thing. Whenever I become an affiliate or I reach out and I start promoting, it's because I use it. I use it personally and I love it. I only provide my audience with things that I would use.
Yeah, me too. Yeah, absolutely.
Yeah.
I wanted to ask you, I saw on one of your stories that your brother's actually on the front line.
He is. He's a first responder. Yes.
So what's his story? Any insight there?
I love my brother. So he's 6 years younger than me, and all the ladies on here would love him. He's got a little country accent.
Oh.
He's single ladies. He actually is a traveling ICU nurse. So is very interesting because he's been places all over the country and that a lot of people haven't seen during this whole mess, So he's actually right now, he's on the border of New Mexico and Arizona. So it's very close to the Hopi Indian tribe. And but it's a very sick population. It's near a reservation. They're very sick population. It breaks my heart.
Diabetes and stuff, right?
Yeah, exactly. Metabolic syndrome, which is the comorbidity, the predisposing factor for a more severe COVID infection. And so these people, a lot of them they drink a lot. They have a lot of inflammation from increasing blood sugars, increasing blood pressure, cholesterol. These are all the risk factors that show inflammation throughout the body. And so, he's really noticed, he actually had a young person on a ventilator, a 31-year-old. He had a few people with COVID actually now at that hospital.
And they survived, or?
Yes, all of them have survived so far, actually, surprisingly enough. Yeah.
That's good.
Yeah.
I actually heard something yesterday. I listened to this really interesting podcast that Tony Robinson, I always forget his last name. Tony Robbins.
Yeah.
He did that yesterday, and it was
Sorry.
You would actually love it. But they talked about in some cases, like the ventilator was actually making things worse. I thought that was interesting.
Correct. Yes. So the problem with that is I'm going to move rooms because the lawn people are here.
Oh my gosh. I told my boyfriend, I was like, if the lawn people come, can you try and get them to stand off?
It's Monday. Yeah. It's like the perfect time. Exactly. So we're going to do like a outfit change, like instead of room change here. So, what was your question again? I'm sorry.
About the ventilators that they could actually,
So the ventilators are treating, this is more of an inflammatory problem. It's not a lung problem. There's not a problem with the lungs or the tissue being too tired to breathe, which is what ventilators provide. This is a problem with a cytokine storm or so much inflammation that the body's response to the pathogen that it's never, ever seen before, most likely, right? So that's the problem, is the cytokine storm. There's nothing wrong with the lung architecture. So actually sticking a tube down people's throat and intubating them on a respirator, the problem with that is that you only have 10 to 14 day period there for it's safe to keep people on a ventilator. After that, it starts to actually destroy the architecture of the lungs. And they want to do a tracheostomy and put the tube here, because it's damaging to the trachea and the lungs to have it in longer than 2 weeks. So, of course, this problem with COVID lasts longer than 2 weeks. You hear people who have symptoms, they think they're getting better, then things flare again. It's more of a long process than what we anticipated. So just sticking people on a respirator so they can't breathe or a ventilator is not the answer, since the COVID virus seems to flare so much longer than that anyway.
Yeah. I've heard somebody else say, and I don't know if it's true, that's why I'm asking you, because it seems like there's so much information. It also seems like everybody's figuring it out. Everybody, like, yeah, everybody's just kind of figuring it out right now, but that it's similar to being put on the top of Mount Everest and not allowing your lungs to assimilate. Is that true?
Right. It's more of a problem with the exchange of the oxygen than the actual problem with the lungs, right? So even if you are pushing oxygen into the lungs, if the exchange isn't happening between the cells, then that's the issue, right? So that's the problem they're just now figuring out. It's altitude sickness is a good
sickness.
It's a good way to compare it, actually.
Yeah.
Yeah.
So interesting.
Mm-hmm.
Wow.
Yeah. So, that's not always the answer. I mean, it's always been the answer. I've intubated people. I've put people on a respirator before. I know all about the settings. I know all about, the standard procedure with it. It's just sort of allopathic medicine's answer to if people are short of breath or their oxygen saturations are low, the standard protocol is you rescue their lungs by sticking a tube down their throat.
Right. But this is a new disease that we've never seen before. So we're all just kind of figuring out what is the protocol.
So yeah, you don't really want to use old techniques on a new dog necessarily.
Yeah.
You know what I mean? It's not really a great answer for this virus. And so I think that what you're saying is dead on. Yeah.
Yeah. So what could you recommend to people that are watching right now that have maybe just don't even know where to start? Like, do I take vitamin C? Do I eat vegetables? Like, what do I do?
Yeah. First of all, let me tell people I've had so many of my patients flaring with their autoimmune symptoms just because of stress. And so first of all, take a deep breath and know that this numbers are stacking up not to look much worse than the flu this season. That's what things that the people are really recalling the numbers. They're really recanting the promises of death and destruction they had made previously. So I don't want you guys to buy into the fear and hype, because that actually is so counterproductive for your immune system. And stress is so underplayed. It is a big problem in everyone that gets chronically ill. It is absolutely part of their perfect storm. So watch your stress, guys. Please breathe into your stomach. Please don't let the stress interrupt your sleep, which is one of the foundations of health. I can't get anyone better until they sleep properly. And so, I really want you guys to focus on just that, just breathing and calming yourself down. Other than that, the staples of good health include what you're putting in your body, what you're thinking about, the people you're hanging out with. So, I hope that you have a good relationship with your family and that you have good community right now in whoever you're living with or speaking to on a daily basis. I think it's really important to eat organic food. Herbicides destroy the way plants make essential amino acids, and that's where we get our essential amino acids are from plants. So they're causing stripped food. So really, to get the full nutrient profile from your food, you really want to stay away from herbicides and pesticides. You really want to eat whole food that your ancestors would recognize. Grass-fed, pasture-raised meats, glandular meats are really useful here, guys. If you think about the way this virus attacks our immune system, it goes straight for the thymus and a lot of the lungs. And so eating glandular thymus tissue that's organic is really the way to heal that and protect that gland. So glandular is really, I think that's why our ancestors ate organs, is because they knew the benefits of these meats. So even if people are vegan, even on Gerson therapy, which I'm a Gerson therapy practitioner, we give people glandular meats in their diet, because even on a vegan diet, we know the benefit. So that's really great for people to think about. You may have not thought about that with this virus, but that's really important.
I did. Another doctor actually mentioned that to me, because I'm not vegan right now. And she was asking me, like, what are you eating right now? And honestly, because we're trying to limit our grocery store runs and the stress of just going and the whole thing. So I'm not eating as many fresh vegetables as I was before. So I'm eating a little bit differently. And she was like, make sure you get your meats and your bone broth and stuff like that. And she said something about that. So that's interesting.
Yeah, and bone broths are great because they replace the amino acid structure. Proline is really important for collagen as well. And so they really help to replace the amino acid structure and heal the lining of the gut, which is where 80% of our immune system is, right? And it makes the happy neurotransmitter serotonin, 90% of that. and that transfers over to melatonin. So people who don't have good immunity and don't sleep well, and aren't very happy often look to the gut for this problem. So really learning to heal the gut with foods, whole foods from the earth, taking care of those sugar cravings, which can indicate candida or some other hidden infections. Those really can cause a lot of inflammation that's hidden in the body too. So really find a doc that's able to dig. You know, if you guys have something like Hashimoto's or like rheumatoid arthritis, you know, really look to a doctor that can do a specialty test, you know, things that look for, you know, hidden pathogens and heavy metals and things like that, that can really trick the immune system, because in my belief, the body is perfect. It's the genes are changed along the way by the environment that passed down to us.
Yeah. Oh, I love that. You gave so much amazing advice. I always ask everybody that I interview, and just tell me the first thing that comes to your head. What is your golden secret?
Ooh, for me and my body, fascia blasting.
Ah, I saw your IGTV on that. I loved it.
Yeah, it changed my life. I mean, I know that there are horror stories about fascia blasting and what happens. I've read them, but let me tell you why. That's because fascia is so powerful. It's actually the first thing that's formed when an embryo is forming, is the connective tissue.
Wow.
It carries all the chemical communicators and hormones in the body for us. So you can imagine if we have a lot of trauma or we have a lot of things that are hidden and buried in our body, toxicities and emotional toxicities, and then someone's scrubbing them out with if you guys don't know what a fascia blaster is, look it up. The fascia is the connective tissue under the skin. And for me, I had a lot of bound up fascia, and my body, that's just where it stores toxicities. And so when they break that loose, you can have healing detox reactions from that. You could Herx from that, have Herxheimer symptoms, healing detox reactions, which means that we're releasing toxicities from the body that your body had buried and crunched inside, right? And was hiding. So when you release that, it can feel terrible till you get it out, but you definitely don't want it in either. So for me, fascia blasting was like this emotional and physical detox.
I love that.
Yeah.
And I'm right there with you. I mean, living with rheumatoid arthritis, I feel like I hold a lot of tension in my body, in my joints. So, you know, I have to constantly stay fluid and move. And I completely agree with holding things in the body. Again, as a yoga teacher, I've seen it firsthand, like people just having these immense releases, being in a hip pose or, you know, anything where they kind of let go. We hold a lot of emotion in there. So I love that advice.
Yeah, yoga is my other secret. I have to say, I applaud you for you being a yoga teacher. Yoga saved my life. It really did.
Me too. Like over and over and over. Every time.
Layers to it. Yeah.
Yes. I love that. You're such an angel. Thank you so much for sharing everything you've been sharing. If you guys aren't following Dr. Jess, go follow her. Stalk her IGTVs. There's tons of wisdom in there. And this is also gonna be on EverTalk TV. Oh. Yeah. So if anybody misses it, they can watch it on there.
EverTalk TV, amazing. Okay.
Yes. It's it's like they're quick. Like he's gonna tag you in like 2 minutes. It's already gonna be up.
I love it. Oh my gosh, guys, go watch if you missed it. We talked about all the things. So yeah. Thank you so much. I'm humbled that you had me on. Thank you.
Oh, thank you. Have so much fun on your trip. I'm excited to see your little adventure.
Thank you. Yeah, we're excited. So yeah, I'll keep you guys posted.
All right. Stay safe. Thank you so much.
Thank you. Thank you guys. Thanks for watching.
Bye.
Bye.